Okay, everyone, welcome to Labor and Health. Good to see smiley faces. Just a quick review of decorum rules we have here. The number one rule in this committee is if you have a cell phone, turn it off unless you'd like to buy donuts, and please leave it on because if it goes off during committee meeting, for the meeting on Wednesday, we'll expect donuts. Okay? The only other rule we have here, we have a lot of rules, but the second rule is that we treat each other with respect here, both from the committee side and from those who are testifying in the public. We try to get things done on a professional basis here and make sure it's done well and thorough, and that we treat each other with respect and kindness. So with that in mind, we have 3 bills before us today. Let's take roll, please.
Senator Barlow.
Present.
Senator Bouchard.
Here.
Senator Dockstader.
Excused.
Senator Hutchings. Chairman Baldwin.
Here.
We have 4 present, Mr. Chairman, and 1 excused.
Very good, committee. The first bill on our agenda today is Senate File 57, Wyoming Adult Hearing Aid Program. Senator Furphy, come up front and center, sir. Tell us what's on your mind and tell us about your bill.
Thank you, Mr. Chairman. Dan Furphy. I thank you for hearing this bill today. It's an important issue, as you'll hear from some of the testimony today. We're trying to help the hearing impaired and the deaf community. As I found out, one of the people in here to testify today asked me to attend a meeting about a year, maybe a year, 2 years ago. And I said, sure, I'll come. And what I was surprised to find is the number of deaf and hearing impaired people at that time, just Laramie and Cheyenne. But then after doing research, surprised at the numbers in our state. So I scheduled a meeting with the governor to meet these individuals. The governor was very sympathetic towards these individuals, and he assigned one of his staff, Jen, I guess I can't use the names, but I'll use first name, Jen, who's one of his senior advisors, to work on this issue. And she did, and she developed a whole study on the hearing impaired, and this is available if anyone wants to read it. But as part of the plan that we've put together, the first step to help these people was to get them hearing aids that they can afford. And that's the purpose of this bill, Mr. Chairman. And so if you want me to run through it quickly,
Please,
I
let's
won't
walk
go through it step by step, but the definitions, of course, are the Department of Health and eligible adult. And this is important. We're not looking for children. Children are covered under the CHIPS program, but these are for adults that are not less than 18 years of age and have been diagnosed by a physician or an audiologist with a hearing impairment, and key to this, has monthly modified adjusted gross family income at or below 200% of the federal poverty level. So these are people who are struggling financially and they really can't afford hearing aids. So they need help. If you look at page 3, eligibility shall be determined by the Department of Health. So a person shall not be eligible to receive hearing aids after the department has determined that they don't qualify under private insurance, Medicaid, Medicare, or any other third-party payer. And if they qualify by the Department of Health, they can have one set of hearing aids under this article in any 5-year period. So they can't have changes more than every 5-year period. And it's based on the cost of hearing aids are determined by the Wyoming Medical Assistance and Service Act, and I've reviewed that act. And so it's a cost that's very reasonable. And so Section 3, the Department of Health determined they can implement this program with a cost of using one of their part-time staff for $9,000 a year. And if you go to page 5, Section B, the Department of Health determined they can implement this program for $90,000, and that's it. So, Mr. Chairman, we need to implement this program to help these people. They really don't have any other source. They can't afford hearing aids. And so, Mr. Chairman, I'll stand for any questions.
Questions for Senator Furphy, committee? Senator Bouchard?
Thank you, Mr. Chairman. Senator, I look at the bill and I do sympathize with what's going on here. But when I look at page 4, and then it's got on line 4, at a cost of no more than, and then it also says that again on line 9, we've seen this in the medical field. And what happens is you have doctors that pull out of the medical field and say, we just can't do this because it doesn't pay for our office staff and our rent and everything else. So that's kind of what I see here is we're doing the same thing that's failed on the medical side, because we're going to say, well, this costs you more, but we're going to limit the price. And this gets that catch-22 when the government starts saying, we're going to tell you how much something costs. Now what the provider has to do is actually sell at a higher rate to everyone else to try to subsidize and offset this cost, or say we're not going to accept these patients. So what's your answer to that?
Senator Furphy.
Thank you, Mr. Chairman. Senator Bouchard, fortunately in our state, there are some services that are available. For example, I'll use the institution across the hill. They have an audiologist who operates at probably below cost to help people in our state. And they do ear molds, and they have access to hearing aids by some of the good companies. and that's what we need to do. So, yes, Senator Bouchard, it is a problem. Most providers could not afford under the Wyoming Medical Assistance and Services Act, but there are some in our state, and that's what we'd have to focus on, finding those individuals who would take care of these people. Thank you.
Okay. Senator Hutchings, go ahead.
Thank you, Mr. Chair. Thank you, Senator Furphy. Can you just briefly touch on what the Wyoming Medical Assistance and Services Act does? Just briefly.
Yeah. Thank you, Mr. Chairman. Senator Shard. It does outline for our state basically the costs that are covered under Medicaid and material and equipment, et cetera, that can be purchased under this act. So that's very brief summary, but it is useful for our state in helping provide services that may not be available otherwise.
And we'll have the department up here in a minute who can probably further answer that question. Further questions for Senator Furphy? Senator Furphy, do you have any idea how many audiologists there are in the state of Wyoming? You may or may not know.
I don't know that for certain. I would be guessing, Mr. Chairman. There are quite a few across our state,
Okay.
which is a good thing. Unfortunately, as all of us get older, we're going to maybe have to take advantage of those individuals.
Nobody on this committee, Senator, is getting younger, I assure you. By the minute, we're getting older. Senator Dockstader, maybe by the second. Thank you very much,
Wait,
Senator
wait, sir,
Furphy.
sir.
Oh, we got
Senator
one more
Furphy?
question for you. Senator
Senator
Furphy?
Furphy,
Senator Furphy, one more
one
question.
more
Oh,
question.
I'm sorry.
Go ahead, Senator.
Mr. Chair, do you have an idea how many people we're looking at getting into this program? Just a rough?
Senator Furphy.
We haven't updated that for a while.
Are they kind of breaking down the door to get in, or are they just
I
trickling?
look to
Department of Health?
individual I work with, Mr. Forrest. How many? You were part of a study. How many in our state? Do you recall?
He'll do it when he comes up.
No.
He'll do it when he comes.
People that are in the hearing impaired.
Approximately, the last results of my last study was 29,000, and that was in 2020. That was the data that I.
Okay.
It
And-
exceeds that now.
And we'll bring that gentleman up here in a minute.
Gotcha, thank you.
More questions.
Yeah.
Okay, Senator Barlow.
Mr. Chairman, thank you. So I think probably the focus of this is in the footnote, and it's 30 people, but this program, based on the funding available, is in the footnote, and that is estimated at 30. So anyway, we're not talking about the entire population of the state of Wyoming that may have hearing impairment. We're talking about starting with a number that would have access to this program, would be 30. So thank you, Mr. Chairman.
Thank you for that clarification. Okay, this time you're free to have a seat, Senator Furphy. Thank you. Department of Health. We're happy to see the Department of Health. We've missed you in our committee. Welcome back.
Mr.
Go ahead.
Chairman, members of the committee, Lee Grossman, State Medicaid Agent, joined to my right by Franz Fuchs, and I'll let Mr. Fuchs introduce himself.
Thank you, Mr. Chair, members of the committee. Franz Fuchs, Policy Analyst, Department of Health.
Mr. Chairman, members of the committee, largely here just to answer any questions that you may have. Just listening in to date, wanted to confirm our staff, we developed a fiscal note. So based off of the $90,000 appropriation and based off of current Medicaid payments, which are specified in this bill in terms of what we would use if this program were to be implemented, that's where the 30 estimate came from. Could be more in terms of if someone, let's say, needed one hearing aid, that would obviously free up some additional cost. But we would anticipate from the administrative perspective, likely having a wait list in terms of demand potentially outstripping the 30 estimate. That's something we're prepared to administer, as has already been noted here today. And since Medicaid has the infrastructure to essentially complete these functions, we would be prepared to do that with, again, the relatively limited AWAC position resource that of 9,000 that is currently in the bill. Last but not least, earlier we heard a question about the number of audiologists in the state, and my quick colleague to my right here was able to locate that we have 12 Medicaid enrolled audiologists statewide. And with that, stand for any questions, Mr. Chairman.
Questions, committee, Senator Bouchard.
Thank you, Mr. Chairman. What I want to know is how many people are currently handled in the federal system? In other words, between Medicare and other service, other help that comes from the federal government, how many people are already taken care of there?
Go ahead.
Mr. Chairman, Senator Bouchard, including the Medicare information, that's data that we would not necessarily have access to, but I'm going to look to my right to see if Mr. Fuchs might have more information on that.
Mr. Chairman, Senator Bouchard, last year there were 468 Medicaid members who received services through Medicaid for audiology services. 468.
Okay, further questions, committee? Seeing none. Thank you, gentlemen. I don't see any other departments who may wish to testify today. Others who may wish to testify on this bill, come on up. Don't be shy. The seats are warm. The mics are hot. You bet.
We have a deaf individual in there testify online and struggling to gain access.
Okay.
Thank you, Mr. Chairman.
Go ahead and introduce yourself and
Yes.
tell us everything that's on your mind. Well, not everything, but everything focused on this bill.
Well, good morning, Mr. Bring us here. Did I need to push this? No. Okay, there we go. I just want to make sure our people online can also hear as well. So yes, my name is Scott. I am a Wyoming small business owner. I own a company called Deaf Intervention Services, and I work
What's your last name, sir?
for FOOR.
Very good, thank you.
And I have been working here in the state of Wyoming for the last 9 years, just helping deaf and hard of hearing people around the state to gain access to services. In our state, we are actually the only state in the union that does not have a school for the deaf, a residential school for the deaf, a deaf or hard of hearing commission, or a nonprofit that supports deaf people of all ages. And so earlier, Senator Furphy referred to an invitation from someone in Laramie. That was actually me. I asked him to meet with me and a number of deaf individuals around the state, and he's been working with us actually for the last 4 years. And he's been an excellent resource and support for deaf people, helping them to gain access to services throughout our state through a number of different departments within the state. And so, as I mentioned, Wyoming is the only state in the union without one of those three programs. Most states have at least one, 2 or 3 of those programs, if not more. And so this bill that Senator Furphy is introducing is actually just a small step in the right direction to help this disadvantaged community to gain access to services. So the individual who I referred to online who is not able to access the link, she herself is deaf. She is bilingual, and so she uses spoken English to communicate with other hearing individuals in her job and out of her job, with her family, of course, as well. And then she also uses American Sign Language to communicate. So she communicates using both languages. Unfortunately for her, she herself, her hearing aid will cost $7,500, which is, and that's what she can afford. A good powered hearing aid will be a car payment for her. And that's critical for her and her job. Unfortunately, when she approaches her employer asking for access in American Sign Language, that service is not readily available in our state. And so a $500 subsidy is certainly reasonable, and it would help individuals like her. But again, as Senator Furphy mentioned, that's only for individuals who are at 200% of the poverty level. And so individuals like her who are gainfully employed may not necessarily qualify, nor may they be able to support that cost. Mr. Chairman and Senator Bouchard, I appreciate your question about, that unfortunately drives up the cost for other devices. And so my suggestion, or for the rest of the community who's purchasing hearing aids, and so my suggestion would be that that subsidy would be offered directly to those individuals, not necessarily that they would have to accept that price for hearing aids, so that the providers are forced into accepting the $500 payment, but perhaps that could be a payment that the state is making to that provider, and then they can come up with other financing options to help the individual. So that's another avenue to approach the bill. And I mean, that's really all I have to say for now. If you have other questions, I'd be happy to answer.
Questions, committee? Senator Bouchard.
Thank you, Mr. Chairman. So, since you brought it up, we've broken a healthcare system by saying we're going to subsidize, or we're going to pay, and it's supposed to be affordable. But then you have a whole other group of people that are just being gouged. And so that I look at this as just another Band-Aid that does that. So how can I support it if we're, I mean, I'm sympathetic to what's going on, but at the same time, if we're just going to put another Band-Aid on and break another part of the system, how does that benefit us in the long run?
That's a fair question, Mr. Chairman and Senator Bouchard. I don't have the answer to that, and I don't think you do either. It's a very complex system. Yes, we do have a broken healthcare system, but I can tell you right now, I'm appreciative of Senator Furphy and Governor Gordon and the support that they've provided to the deaf community. This doesn't necessarily relate to the hearing aid bill, but I can be very specific with some statistics and say that right now it's estimated that less than 2% of deaf and hard of hearing people have access to mental health services across the nation. And so here in Wyoming, it's even less than that 2%. And so, yes, we have a broken system. However, this right now is the only suggestion that Senator Furphy and Governor Gordon have come up with to push this forward in terms of finding a solution to help and support a very disadvantaged people group. Because the reality is, if we don't support them to be gainfully employed in our workforce, then they will become dependent on the system even further. And not just our healthcare system. They become more dependent on our unemployment system, our federal systems, our state systems. And so in the long run, this is an investment in the workforce, not just an investment in healthcare. So that would be my response, Mr. Chairman and
Thank you.
Senator
Further
Bouchard.
questions? Senator Hutchins.
Yeah, thank you, Mr. Chair. Scott, thank you for coming in. I know this is difficult, and I, too, dislike government programs. I really do. But there are times when we look at people that are truly disabled. They're not of their own. They're not out drinking, possibly. They're not shooting up drugs. They're not doing things to themselves that are creating an issue that we want to come in and fix. And you have to look at the proper role of government. And for me, just knowing deaf people and seeing the struggles that they have, this one seems like it would be something we should want to do to help the disabled because they're disabled. Now, we're talking about a lot of money to help just a few people. I mean, how are we gonna, what's your design for spending 99,000 to possibly help 30 people? Do you have people in line waiting to come and get into this program as soon as we can get it up and running? What do you see in the future this program really doing for your community?
Go ahead, sir.
Mr. Chairman and Senator Hutchings, the reality is that yes, this is just a Band-Aid. This is not a permanent fix. In truth be told, perhaps that $99,000 could be better spent on more comprehensive support, such as a commission for the deaf, because then that would be something that could support all aspects of government. For example, excuse me, I know we're not supposed to use names, but the governor's senior policy advisor has done research, and one of our neighboring states, Nebraska, which is very similar in makeup to Wyoming in the sense that, you know, we have a very large rural dispersed community with, you know, a few metropolitan areas. And they have set up a commission for the deaf that holds equal authority within the government to educate different aspects of our government. And so when we have someone in the judicial system who's denying access for a deaf person who maybe can't hear and needs captioning, or maybe they need a sign language interpreter, as you guys so appropriately provided today, they can educate the Department of Education. They can come across and educate the Department of Transportation. They can work with the Equal Employment Opportunity Commission, different aspects of government. So if you're asking me if this is a solution, yes, to some extent, but again, you're right, there are narrow margins here. We're talking about 30 people. And while I do think that a hearing aid bill is a wonderful support, it is restrictive in the sense that it only helps those who are hard of hearing. Whereas if those funds were appropriated to a commission for the deaf, which would be deaf and hard of hearing, that could be all encompassing. That could support those who need hearing aids. That could support education. That could support sign language interpreting. So I don't have the best answer for you, Mr. Chairman and Senator Hutchings, but I can say that yes, this is a Band-Aid, and ultimately, as mentioned previously, we're the only state in the union without those appropriate supports in place. So we need a solution. And yes, government exists to provide services for the people. And I am grateful to see our tax dollars here at work. And I appreciate each of you for being here. And I have expectations for my tax dollars to be used to clear the roads. I have expectations for my tax dollars to be used for the ADA accessible ramp or the elevator or the sign language interpreter. And so I'm appreciative of all your effort on this bill. So thank you.
Thank you, Scott. Mr. Chair, for the follow-up. You mentioned nonprofits. I know you've come here. Have you guys looked into a program like other states have? Hey, how can we develop something here in Wyoming, a nonprofit, to get people to contribute? Because I'd rather see money coming from the citizens to help than the government. Because once you get entangled with this, it's messy.
Yes, it is.
I'm just gonna be honest with you. You're probably not gonna like what happens. But have you thought about that? Looking into nonprofits?
Oh, absolutely.
Go ahead, Scott.
Yes. Thank you, Mr. Chairman and Senator Hutchings. I myself left teaching American Sign Language at the University of Wyoming to go into public service. And the only way I found to do that was for me to open my own company. And in doing that, I've set up a limited liability corporation and am setting aside revenue. And I do hope one day to open a nonprofit myself. But again, that is not my responsibility to comply with the Americans with Disabilities Act. That is the government's responsibility. I do want to open a nonprofit someday. And I do want to support our deaf and hard of hearing citizens in our state. But I do believe that our government needs to step up in the state of Wyoming. I do believe it's messy, as you mentioned, but I still believe it's an expectation and a requirement under federal law as well that all states must abide by.
Thank you.
Senator Dockstader, did you have something?
Scott, somewhere in there you said a number. I thought you said 30. So we got $99,000. These are 30 people lined up, ready to receive the help. Who's out there ready to lined up to receive that $99,000?
Go ahead, Scott.
Thank you, Mr. Chairman and Senator Dockstader. Yes, there are people who are waiting for these services. Absolutely.
Follow up, Mr. Chair.
Go ahead, sir.
What's the number, though? That's what I'm trying to narrow it down to.
I don't have that number. I do not. I wish I did. And again, the report in terms of that data is very narrow.
Mr. Chairman, certainly there's been something that's provided you a basic template of numbers. These are the people generally on average who receive help, who could use the help, but there's some that may not need that help.
Oh, yes, absolutely. And that perhaps is a better question for the Department of Health. However, Mr. Chairman and Senator Dockstader, I believe the last report that was comprehensive in terms of how many people could necessarily benefit. I know that the last investigation was in like 1991, I believe, when the Workforce Services investigated how many deaf and hard of hearing people there were in the state. And that was kind of an intense study. And I believe there was like an estimate of somewhere between 300 to 1,200 American Sign Language users in the state. And again, that number that I have from 2020 from my own research within my company was about 29,000 deaf and hard of hearing people in the state. And that was comprehensive, but we don't have current figures on how many American Sign Language users there are. And in terms of them accessing hearing aids or those types of services. So I can't really answer your question with a definitive number. That data is just not available to me in the public sector.
Thank you, Mr. Chairman.
Thank you. Any further questions? Seeing none. Thank you very much for testifying.
Thank you, senators. Thank you, ma'am.
It's a scary seat there. We all know it is. At some point, we've all been there. Come on up, introduce yourself, and go ahead and tell the committee what's on your mind.
Chairman Baldwin and committee members, my name is Paul Montoya. I live in Laramie, Wyoming. I'm taking a little bit different direction on this particular bill. I'm actually here to speak against advancing the bill, especially as written. And I do appreciate Senator Furphy and the hard work he's put into this, but I think the bill is way too broad, as it's kind of been demonstrated by some of our previous people that have spoken. We don't know how many people there are in the state that have hearing loss. The bill is written in such a way that it's very broad. It just basically says hearing loss. My career life background's been in technology, and I feel that this bill's unnecessary for a lot of people with hearing loss due to the rapid advancements in hearing aid technology. As you know, hearing aids are regulated by the Food and Drug Administration, and in 2017, they actually created what's called the Over-the-Counter Hearing Aid Act. This made available regulated over-the-counter hearing aids at a reasonable price for mild to moderate hearing loss. Previous hearing aids were manufactured just by 6 hearing aid companies, with the average single hearing aid costing $2,300. Keep in mind that most people need 2, so double that price. About 3 years ago, my mother-in-law, who lives in Kansas, was in a local shopping mall. A salesman from a hearing aid kiosk talked her into purchasing prescription hearing aids. These cost her $5,000 for 2 hearing aids. She didn't have $5,000, but that wasn't a problem. They were willing to finance the hearing aids for 2 years at just 22% annual interest. After 2.5 years with these hearing aids, one of them actually failed. They said, no problem, for an additional $1,500, they'd extend her 2-year warranty 2 more years. Needless to say, we talked her out of moving forward because she has mild to moderate hearing loss. She doesn't have severe hearing loss like some of the people that have given testimony. A lot of well-known audio companies such as Bose and Jamba and Apple in the last year have entered into the hearing aid business. One of those companies, Apple, was just featured in an article in last month's National Council of Aging magazine, Advisor. The article is entitled AirPods as Hearing Aids, New Features Announced. They stated that, quote, Apple's innovative AirPods could revolutionize hearing support, bridging the gap between hearing loss and accessible, affordable, and stigma-free solutions for both older and younger generations. If you're familiar with AirPods, the Pro version costs only $250 and is controlled by apps as far as fine tuning. There's apps for doing actually hearing tests now. I encourage you to look for that article if you can. I can send you a link if you like. This is a well-meaning bill, and I sympathize with the hearing loss community. My sister is actually deaf. My wife, Lynn, actually is a sign language interpreter. So I understand the plight of the people with severe hearing loss, but right now, the way the bill's written, this could really apply to anybody. And I have a feeling that it's money spent for something that's probably not really needed, at least at this point, or at least modified to really focus on the people with severe hearing loss. So I ask you maybe not to advance this bill. And if you have any questions, I'd be open.
Senator Barlow has a question.
Thank you, Mr. Chairman. Mr. Montoya, so where in the bill would you like more specificity? Because if I look on page 2, eligible adult, it's an age, it's a diagnosis, and a requirement that that diagnosis is followed by hearing aids, and a family and an income level. So there's 4 qualifiers. What other qualifier would you like to have, Mr. Chairman, Mr. Montoya?
Go ahead,
Thank
Mr.
you.
Montoya.
Mr. Chairman, Senator Barlow, the specification I like to see is some sensitivity to hearing loss. I'm not an audiologist, but I think there are many levels, probably 2/3 of the people with some type of hearing loss, myself included, don't need something as sophisticated as a full-born $5,000 set of hearing aids. Most people can get away with something quite a bit less expensive than that. So if we're really focusing on the deaf and the severely hearing impaired community, I think we need some type of guideline as far as a level of hearing loss. And like I said, I'm not an audiologist, but there'll be a decibel level that they'll be able to specify as far as needing something more than an over-the-counter hearing aid.
Follow up, Senator Barlow.
Thank you, Mr. Chairman. So maybe there's a different word besides impairment that is of value. But I'd also note that in Section 3 or Section 2 of the bill, the Department of Health has rulemaking authority. So in that process, there could be actually something to your point about defining what impairment or what level of impairment those folks would be eligible for. So anyway, there may be a way that this gets done without us trying to figure out how to wordsmith the bill. But anyway, I just wanted to point that out. We do have rulemaking authority where maybe that can be taken into account. Thank you.
Very good. Further questions, committee? Seeing none.
Mr. Montoya, your occupation, you said digital, is your background in anything related to hearing other than family members associated with it?
Only audio, Mr.
Go ahead,
Chairman,
Mr. Montoya.
Senator Doxter Stetter. only in audio mixing, professional sound, radio broadcasting, but technology in general. I'd like to keep up with technology, but no, I have no qualifications in audiology.
Thank you, Mr. Montoya.
Okay, thank you. Yeah, you guys can get going talking here, and we're not going to let it go.
Yeah.
Okay, thank you very much, Mr. Montoya, for testifying. Further in the audience, anyone else wish to testify? Oh, Mr. Montoya, I guess we got one more question here. He's got to get his hand up quicker. Go ahead, Senator Bouchard.
Thank you, Mr. Chairman. My question's simple. You talked someone out of extending this hearing aid plan. What did they pay for it? Did they get it over the counter, and what did they pay for that?
Mr. Montoya.
Mr. Chairman, Senator Bouchard, yeah, we were able to actually get her into, at that time, a Jamba unit. The Jamba unit was about $275 for her. And it's worked very well. It's, very small in size, so it wasn't any more obvious than a regular hearing aid. The Apple products that they're talking about are really the ones that, I'd like to say all the kids are wearing. And so it's very acceptable in social circumstances. So even the direction that Apple's going, it's a very inexpensive product for most people that just have, like I said, minor to moderate hearing loss. Works well, which is really the majority of the population.
Okay, I'm going to watch for your hand to come back up. Not seeing it come up. Okay, this time you're off the hook, Mr. Montoya.
Thank you.
Okay, others who wish to testify to the bill in the audience? Seeing none. Are there any online to testify?
Mr. Chairman, we have 3 people online. If any of them would like to testify and raise their hand.
Raise your hand, and I would remind you that we need to make them kind of quick testimonies. If you've heard it already, state it briefly so we can move on. We have 2 other bills waiting in the wings. No hands being raised. Public comment is closed. Committee, anyone wish to move this bill? Bill moved by Senator Barlow, second. I'll second it. Okay. Okay, committee discussion on the bill. Yes, go ahead, Senator Dockstader.
What we're trying to do here, and I see the concept, but I go into this with reservations that we don't have specific numbers. We just kind of got a big, broad approach to how we're going to correct this matter, and we don't know, we're not using numbers from the past, the present. We don't know where this $99,000 is going to take us. That's my concern. I may be with it to get it out of committee, but that's, maybe the sponsor can round up those numbers for us if we do that, put it on the floor. Thank you.
That sounds like an appropriate thing to me, and I would also suggest if this does not get off the floor, if it doesn't get out of committee, whatever would happen, it certainly is a good topic for an interim topic, which is a reminder to everyone in the room who is interested, deadline's coming up for submission, anyway, for interim topics. Further discussion, committee. Go ahead, Senator Barlow.
Thank you, Mr. Chairman. So I must be the only one at this dais that has hearing impairment.
Oh, no.
Okay, thank you. Yeah, thank you, Mr. Chairman. I actually have a prosthesis in one of my ears too. So I have, and it was a lot more than $3,000. So anyway, so I'm very sympathetic to folks that may be challenged. And I think the eligibility, for me, the eligibility characteristics are adequate. If there's improvements that can be made, that's fine. There's one part of this bill that I don't understand, and we don't have to try to flesh it out now, but on page 3, under the eligibility, line 9 to line 14, there's a sentence there that talks about if you're eligible, to be eligible, you cannot be eligible through any other program. So basically, this is the insurer, if you will, of last resort. But I don't understand the qualifier at the end, for less than or equal to $500. Because the fiscal note starts talking about, $3,000 for 2 sides. So like I said, we don't need to flesh it out now. I'll just get with staff, or I'll get and with Senator Furphy to understand what that actually means. Because I quite honestly don't understand it. I don't know if it's necessary for the bill. I think if these folks can't afford it, they don't qualify for any other service, then so be it. The other thing I would make mention of, and I'm not going to bring any amendments, but if Senator Bouchard wants to solve the cost shifting that occurs between the Wyoming Medical Assistance Program and private insurers, we should raise the reimbursement rate for Medicaid, so we wouldn't have that. But that's an appropriation in the budget. So I just point that out, that if you want to change that dynamic, you raise reimbursement on Medicaid. Thank you, Mr. Chairman.
Thank you. Further discussion, committee? Seeing none, let's go ahead and take a vote on it, Ms. Shippen.
This is a roll call vote on Senate File 57, Wyoming Adult Hearing Aid Program. Senator Barlow, Senator Bouchard, Senator Dockstader, Senator Hutchings, no, and Chairman Baldwin. We have 3 aye and 2 no, Mr. Chairman.
Okay, that bill passes out of committee. Congratulations, Senator. Get with Senator Barlow, and we'll look forward to the presentation on the floor. Okay, we're all going to take a deep sigh here for a minute. We just went next door to summon the presenter for our next bill, Chairman Landon, who is busy chairing the committee next door, and we have to draw him over here. So refill your cups of coffee or whatever you need to do. Mr. Chairman, welcome to Labor and Health. These folks are coming back, I promise, that aren't sitting here. Yeah, come on up and join him.
Mr. Chairman,
Welcome.
thank you. Good morning.
It's good to see you here. Tell us who you are first.
Yeah,
We might know you, but we might not. Go ahead.
yeah. Well, Senator Landon, really happy to be in front of you this morning and bring you this bill. Unfortunately, I don't have a copy of the bill. I came down here without a copy. I was going to see if there might be an extra copy here.
I think you're in
Senator,
luck.
thank you.
There's a few floating around here.
It's a pretty busy time. We've got members going both ways here, but Mr. Chairman, I bring you Senate File 69 with a lot of passion, frankly. I think the time has come for us to consider this. It was a little over 10 years ago that we considered reimbursement of hospice care at all out of our Medicaid funding. Since that time, at a national level, there have been all kinds of research done. Particularly, I would commend you to a couple of studies, one out of Yale University, one out of the University of Chicago, which has indicated that hospice care actually saves money. It actually saves money from when someone leaves traditional care to go to hospice care, to the tune of $3.789 billion a year that hospice care saves Medicare. So what that translates into is that what we can do here in the state of Wyoming is do the same thing. But that's not the only reason I bring this. Up on the floor, I indicated to all of you some of what drives my passion for doing what we can for these facilities. And it really hinges on the fact that I just think these are such valuable places in our state. It breaks my heart that we lost our hospice center up in Campbell County a couple of years ago. I don't want to lose any more of these. And while this bill represents not very much money for the state of Wyoming, it would mean a great deal to the 5 or 6 hospice care centers in the state. So it's really a pretty simple bill. You go to page 2, and it simply raises the reimbursement rate for hospice facilities from a 50% mark of what is reimbursed traditionally for our nursing care centers to 100%. We think that fiscal note is going to amount to about $125,000 to $130,000 a year. And that's the gist of the bill, Chairman. I could go on for quite a long time about hospice care. I know that you know all about it, but I brought some experts with me this morning who can delve a little bit deeper into what exactly kinds of care are we talking about and what reimbursements are we talking about. If the committee has any questions of hospice care, we have some professionals here. So I hope that's a quick and okay explanation of the bill.
That was exceptional.
Yep.
Any questions for Chairman Landon before we move on, committee? To the experts, so he says. Okay, go ahead.
I was going to say, that's scary. Hi, Mr. Chairman, Senators. My name is Kilty Brown, and I'm the Executive Director of Central Wyoming Hospice and Transitions.
And Senator, Chairman and Senators, my name is Rachel McPherson. I'm the Director of Development at Central Wyoming Hospice and Transitions.
So, as the oldest hospice in the state, I just want to share, we actually provide hospice care in Converse, Platte, and Natrona counties. But there's hospices all over the state. Altogether, we provide care to over 1,900 residents of Wyoming every single year. Most of the time, care happens in the home or the nursing home or assisted living, and that's where people want to be, especially your ranchers. You know, they built that home, they want to stay in it, and that's our job to support them. But every now and then, you have patients who, for reasons, can't stay in their own home. And so that's why we have these 5 hospice centers around the state. Like Senator Landon said, we had 6, but due to financial constraints and staffing, the one in Gillette had to close its doors within the last few years. And to be honest, I'm a little scared about some of the other ones. It's tough, but you know what we do is really important. These homes act as safety nets for our elderly for when they can't stay at home. So what the people we're talking about, this is, you know, your church friend who has church family but never had children and just cannot stay at home anymore and has no place to live. Or sometimes what we're talking about is we have an 86-year-old rancher and his wife is 84 years old and their kids have moved to Denver. And things just get a little bit challenging, to say the least. And that's where we step in. So this bill really focuses on the idea of room and board. And what that is, it's covering the cost of caring for patients. So that's like providing a room, right? It's providing, you know, bathing, feeding. It's providing linens and supplies. And just to give you maybe a picture, it's a very personalized, individualized type of care that you see in these homes. They're staffed 24/7 with CNAs and nurses. And I'm going to say you're not going to see that in most assisted livings or nursing homes. Usually our staff, our ratios are about, you know, 1 staff member to 4 patients, 3 or 4 patients. Again, something you're not going to see in another facility. We provide social workers for counseling to help the family through the grieving process, because this is very family-centered. We also have chaplains, some wonderful ones, who provide spiritual and religious care. And then I think it's really interesting. I think hospice is the only healthcare that I know that does this, but we have volunteers that provide 5% of the direct patient care. So this isn't just all standing on these professionals. So most of our patients have resources for this, but a few do not. I mean, and it's not to say that these are people who are making decisions. This is not where they want to be. Most of them have worked very hard, maybe in low-paying jobs. Sometimes it's women who maybe their wages were, you know, under the table or lower. And that's why we have this. Currently, what's going on is Medicaid pays us $125 per day. That's half of what a nursing home gets. And I want to argue that we give a very specialized, very tailored type of care here. Meanwhile, you know, the quality of care we're giving, in my facility, it costs $700 a day. And that's okay. We're a nonprofit. We fundraise for this, and we totally expect that. You know, our community is behind it. But at the same time, we're feeling a lot of pressures. I'm sure that you guys have heard that nursing wages have gone up astronomically in the last few years. Mine have gone up 22%. And I'm looking at this upcoming year, and it's really tough, and we're having to make hard decisions. And that's where being paid at the same rate as nursing homes, and what I would consider actually would be fairness, would really help us out. And so just to clarify, this bill is really just about adjusting the rates, nothing else. We're not talking about expanding numbers. We're talking about the rates for the patients that we're already caring for. It's not a lot of money for the state, but I have to say it's meaningful and it's a lot for us. You know, I told Senator Landon we're fighting for every dollar, and we are. And this is where you guys can help. Personally, like I said, I see this bill to be about fairness. It's also about recognizing the importance of hospice care in our communities. But I think the other thing is, I think if you guys, you know, vote for and move this bill forward, what you're doing is you're sending a message that the elderly in our community matters and that we value those lives. So I want to thank you for giving me this time today, and thank you for the consideration.
Thank you very much. Questions? Any questions for Dorothy? Or if you think of it in a minute. Well, we're not letting her run away anyway, right quick. Rachel, wait, go ahead if you want anything to say.
Mr. Chairman and Senators, I feel like Kilty pretty much did a great job there. She summed everything up. I will say a couple of things. We never turn anybody away due to an inability to pay. We're going to take care of them regardless. Just last year, we did $351,000 of charity care. That's uncompensated. We don't get paid for that. That is where our community steps in. The majority of that is what funds our hospice homes.
Very good. Any questions for any of these folks? Senator Hutchins.
Thank you, Mr. Chair. Appreciate the testimony. I met these two young ladies in the hall, and very nice. I appreciate that. So figures is another place where I'm really bad. I'll confess. When we're talking about the hospice facility shall not, on page 2, lines 6 and 7, 8. The reimbursement rates shall not exceed 50%. That's what we had. And you're saying now, let's raise that. Let's double that of the statewide average. So you're in essence saying to Medicaid, we want you to give us more. Just to make sure I get this right.
Senator Hutchins, that's exactly right.
Okay.
What this does is just simply move it to the reimbursement rate for our nursing homes. So you can look at it this way. A resident in a nursing home, for example, is being reimbursed to that facility at a given rate. They move that day to the hospice center, and the hospice facility is receiving half of that reimbursement for essentially the same care.
Gotcha.
Does
Or better.
Does that help? Yeah.
It really does. So my big question is, where is Medicaid gonna get the money? Just wondering. Thank you, Mr.
Medicaid,
Chair.
Mr. Chairman,
ahead, sir.
Medicaid is a matching program for Medicare, as you know, and that is state funded. And as I pointed out, what's intriguing to me, Senator Hutchins, is that we'll actually be saving money because that patient will be going to hospice care, which is cheaper for the state than if they are in some other traditional care sort of environment, which could mean the emergency room over at the hospital, for example, where lots of machines, lots of additional costs. So that's what intrigued me maybe the most about bringing this bill is all of the studies that have taken place this last decade, which are beginning to show how valuable this palliative care is. So hope that helps.
Senator Barlow.
Thank you, Mr. Chairman. So thank you for bringing up the uncompensated care issue. So is part of that uncompensated care number the 50% reimbursement rate? Thank you, Mr. Chairman.
Go
Mr.
ahead.
Chairman and Senators, yes, plain and simple. Like, yeah, the majority of it. We run at a deficit in our hospice homes, and we keep them open for our community. They need to have that space.
Well, and you know, I think Dorothy brought up a very valuable point, and that is that the cost of nursing hasn't just gone up for hospitals or for nursing homes. I just read, as a matter of fact, last night, a nursing position open, which making me think about going back into nursing. And it's a $10,000 sign-on bonus, a relocation paid for. It's changed dramatically over the last 3 or 4 years. Anyway.
Mr. Chairman, I think it's really highlighted for us this morning when you think about this silver tsunami that we've got going on in Wyoming. We're the second fastest aging state in America. We've got a lot of older folks coming up through the pipeline, and I just want these facilities to be there, you know, for the times that our families are going to need them. So, and I do want to not leave today without saluting folks like the governor who have actually weighed into, and he actually hosts an event in the summer for these hospice centers to raise money on behalf of what we're talking about this morning. And so I really want to tip my hat to the governor for doing that. He's always come to our community and been a part of that. So it's important to a lot of folks.
Very good.
Appreciate it, Mr.
Further questions, Senator Bouchard.
Thank you, Mr. Chairman. I volunteered in my younger days in a county hospital and worked in transitional care. And so I'm very sympathetic to what you're talking about when it comes to care. The problem I'm having here is, I mean, I can see what's going on here when we say, hey, let's up the Medicaid. But what we're doing here is death by 1,000 cuts, because that's what the Affordable Health Care Act, that was the intention, is to let's make the government the main payer. And that's what we're doing here, is we're saying, let's take more of that. What's going to happen when we have the European model in front of us? I mean, the federal government's broke. The only way they can raise more money to pay for these programs is to print more money. That's brought us to the problem of the overinflation we have now. So if we just keep putting these kind of Band-Aids in place, what are we going to do in 10 years? Are we going to try to figure out how do we tax people to pay for all of it?
Senator Landon.
Mr. Chairman, thank you, Senator. And I respect everything you said. I mean, I respect that, and that really is the policy decision in front of us this morning, is whether or not we feel like we can help to keep these hospice centers going. I mean, it's just that simple. It's also, as the director of the Casper facility pointed out, it's a fairness issue. And then finally, for me, as I said, one of the compelling reasons that I brought the bill is when I learned what this kind of care is doing, and it's actually saving the Medicare funds that you referenced. And so, yeah, certainly a policy choice, Senator, and I respect that.
Okay. Further questions, committee? Seeing none. Thank you very much, folks.
Thank you.
Have a seat and we'll stand by, and we'll get to a vote here in a minute.
And Senator, thank you for the bill.
Department of Health. Welcome back.
Good morning, Mr. Chairman. Lee Grossman, State Medicaid Agent with the Wyoming Department of Health. Again, joined to my right by Mr. Franz Fuchs. I'll introduce him this time. Policy Analyst with the Director's Office. Largely here to stand for any questions on the bill. Mr. Chairman, from an administrative perspective, this is pretty straightforward. As has already been covered, this increases the Medicaid reimbursement rate for hospice room and board. A couple of items I think are of note We heard some more about the history today of this benefit, why this was put into law a little over 10 years ago. This is a unique area in Medicaid where we do not get any federal matching funds. So if you look at the fiscal note, that is all state general fund. Reason being is that Medicaid, from federal regulatory purposes, will not fund room and board, essentially. So that was the policy decision at the time, is that the state would step up and do this with state general fund only. It's my understanding, excuse me, while the disclaimer that I'm not an expert in Medicare policy, but it's also my understanding that Medicare is not able to pay for room and board at an inpatient hospice facility. So accordingly, that's just a brief stance in terms of the administrative workload, which would again be pretty simple when we're talking about rate changes such as this. And with that, stand for any questions.
Senator Barlow.
Thank you, Mr. Chairman. Mr. Grossman, I just want to clarify. Medicaid does not pay for reimbursement of hospice care. They do pay for reimbursement of nursing home beds. Is that accurate? Thank you.
Mr. Grossman.
Mr. Chairman, Senator Barlow, thanks for the opportunity to clarify. That would be just for the, again, paying for the room and board at a hospice facility. But it's my understanding that Medicare will, similar to Medicaid, will also cover hospice in a variety of different settings, nursing facility, in-home, as you heard from testimony earlier too.
Okay, further questions? Senator Bouchard.
Thank you, Mr. Chairman. So I don't know the specific programs, but I do know there were carrots that were dangled out there. So, and I'm saying specifically from Medicaid expansion. So convince me that there's not a carrot on the other end of this legislation, because I mean, it seems to me that's been the plan all along, is let's move another program forward, but there is a carrot on the other end that we can tie in there.
Mr. Grossman, go ahead.
Mr. Chairman, Senator Bouchard, as I stated previously, no federal funds involved here. So if that's what you're referring to in terms of what the carrot would be from the federal perspective, no federal dollars appropriated. This would be 100% state general fund. I hope that answered your question, but please help redirect me if not.
Follow up?
Well, I understand how the bill's written and what you're saying, but is there potentially something on the other end in the federal government that we could apply once this program is in place, that we're going to get more reimbursement from the federal government?
Mr. Grossman, go ahead.
Mr. Chairman, Senator Bouchard, as I sit here today, no, nothing that would come to mind. And again, just simply to the fact that this is a state general fund operated benefit and program. This isn't anything where we seek federal approval. What could come down the road? Left my crystal ball up in the office, but your guess would be as good as mine here too. And I'll look to my right to see if Mr. Fuchs, a smarter individual than I might have some more insight here.
We're hearing a lot about people sitting next to people this morning. Go ahead, Mr. Fuchs.
Mr. Chairman, Senator Bouchard, generally speaking, if we're asking the feds to kick in any match for any kind of program, we would have to apply for like an 1115 waiver. So you'd see language in the bill that would direct us to do that. We don't just do that on our own accord. So we would have to be directed to do that. If there were some kind of waiver out there that could cover room and board on the federal level, we're not aware of those. But if it's something came into existence in a few years, say, you would have to direct us to apply for that waiver for it to actually happen.
Okay. Follow up. Go ahead, Senator Bouchard.
I think I've been on this side of the counter when we were trying to get waivers, and that's why I asked the question. So I mean, if we just keep nipping away and putting more in place, we're not going to have the money at some point because we have a problem at the state level, and then we're going to be on the hook to have to take something. So that's why I asked the question, because I've been on this side of the counter and we've been pushing to get these waivers to expand Medicaid. So I mean, from what you're saying, I think that could be on the horizon.
Any reply? Go ahead, Mr. Fuchs.
Mr. Chairman, if there were a carrot in this particular bill, you would see the federal funds appropriated and you'd see the direction for us to apply for the feds. This is definitely a state policy decision, whether you as a legislature choose to fund the room and board rate at a higher rate than it is now. But as the fiscal note shows, it is purely generally funded. There's no federal funds involved.
Very good. Question? No questions? Thank you, gentlemen. Anyone else in the room which speaks to this bill? Come forward, please. Go ahead and come fill a couple seats, or a seat. If you can fill a couple seats, go ahead, but if you just want to fill one. Go ahead, sir. Introduce yourself and go ahead and speak to the committee.
Good morning, Mr. Chairman, committee members. My name is Sean Murphy. I am here speaking on behalf of my nonprofit organization called Compassion. Compassion supports and advocates hospice and palliative care really whenever and wherever the opportunity presents itself, and that is today in front of all of you. I have been a hospice volunteer in the VA for the last decade. I've been with over 100 veterans in end-of-life care and 2,000 hours in the VA. It got very personal with me. With my son, he was diagnosed with a terminal brain disease shortly after he was born, and his whole life involves palliative care. I'm very familiar with these issues. I've lobbied to Congress for palliative and end-of-life care, and I want to tell you a few things that might help just explain a little bit what Senator Landon said in terms of how does hospice actually save money. We know in the hospice world, and this isn't precise, but the saying goes 70 cents of every dollar spent in healthcare is spent in the last 2 weeks of life to extend it about 2 weeks. And that's because we as a society are afraid of death. We're doing everything we can to prevent it. So we spend a lot of money having scans and tests and procedures to delay the inevitable. But hospice is totally different. I wouldn't say we embrace death, but we embrace comfort care. We embrace the inevitable and we create peace and comfort for people in their final days. And when that happens, people don't make these decisions to spend all this money on crazy things. Like, let's have a kidney scan when you're dying from heart failure, for example. And we see that a lot. And that's where the real costs kick in. So when Senator Landon says it saves money, it's because hospice creates a platform for people to find peace in end of life, to find comfort and to find acceptance that, hey, this is happening. This is a part of being human that we're going to pass. So on a whole, I'm just entirely supportive of this because this helps our hospice care facilities. Sure, we're using, I think the appropriation was, is it 300,000? Was there appropriation with this? I think there was. I look at something like the stable token where we're looking to spend $5 million on a digital token. What does it have to do with healthcare? What does it have to do with helping people in end of life when it really matters? In hospice, I can tell you that's where it really matters. And helping people find hospice and encourage them to say, hey, we're going to cover your full room and board, and Wyoming's going to take care of that. I think that's really important. There's no federal issue here. It's just Wyoming's general fund helping our hospice facilities. Most people want to die at home. Most do. Almost everybody in this room, if you're like, would I rather die in a foreign facility down the road or in my own home? You want to die in your own home. We see that. But for those that can't and don't have the resources or the family or the support to do that, they're in these facilities, and anything we can do to help them, I am for and in support of. So on and in support of this bill.
Good. Questions for Mr. Murphy. Senator Barlow.
Thank you, Mr. Murphy. That was quite touching. You mentioned the VA in your experience. So the VA covers veterans hospice care. Is that accurate, based on what I understood from your testimony? Thank you, Mr. Chairman.
Sure. Here in Cheyenne at the VA, they do, but they have their own long-term care facility, and it includes hospice benefits for those that choose to be on it. And there's a very good system of support to say, hey, you're hospice eligible, and here are all the good reasons to be on hospice.
Questions, committee. Senator Bouchard.
Thank you, Mr. Chairman. I gotta tell you, I agree with you 100% on the whole thing that you said where we spend money over here, but we don't, I mean, I can tell you, I'm a guy that voted against that stable coin. And I agree with you. There's things that we spend money in government, but we don't maybe help a need on the other side. So I think that's where the problem is in government. We have to spend more time working over there to stop where that spending is. And I don't see where just putting more money, I mean, don't get me wrong, I know that there needs to be help here somehow. But we're gonna get to a position where we're gonna spend ourselves into oblivion. We've already done that on the federal end. I mean, unless we get people like you that see that need, see where we're throwing this money away over here, and maybe reappropriating it in the right place, how are we ever gonna fix this whole system? Because this is just a Band-Aid in the bigger scheme of things.
Comments? Go ahead.
Yeah, Mr. Chairman, Senator Bouchard, as I look at that, I'm reminded of what someone told me in the VA one time, and take it for what it's worth. He said, the battle for the souls of mankind will be fought in healthcare. And when I heard that, I don't know, that's pretty loaded. That has a lot going on in it. But when you look at insurance, when you look at Medicaid, when you look at hospital providers, hospice providers, there's all these great parties that are involved vying for many of their own interests. But with me as a hospice volunteer, I look at the last 6 months where the juice meets the squeeze. This is when it gets real. So anything we can do to support those providing care in the hospice setting, I'm here to show up and say, yeah, that's where we win the battle for the souls of mankind. That's where it's going down. And I see so many other appropriations for things that I get it. We want to support these things in government, but it's not anything like our hospice care centers, that there are very few and they meet a very specific need. So to me, in terms of budget dollars in the general fund, this just seems like an incredibly powerful and important use of them.
I think that could well be a quote for our committee. Senator Bouchard.
Just one little follow-up. Like, I want to tell you, I appreciate you. I mean, I'll probably be a no on the bill, but I appreciate what you're doing.
A hospice volunteer to another, absolutely, Senator, yeah.
Thank you very much. Further questions? Seeing none. Thank you very much. for
Thank you, Mr.
testifying.
Chairman.
Any further comments before we take a vote on this or discuss it? Mr. Laycock, come on up.
Morning, Chairman, members of the committee. I'm Tom Laycock, Associate State Director for AARP Wyoming, or a membership organization for adults 50 and over in Wyoming. I wanted to express my support of the bill, thank the bringer of the bill for its introduction. AARP policy asks federal and state policymakers to support improved palliative care and improved access to palliative care services regardless of setting. And that is the basis of our support today and the reason I'm before you today. It's our understanding Medicare does pay the bulk of hospice care itself. However, this money would go to the room and board for standalone hospice centers. To my knowledge, we have 5 in the state. It's our hope that this increased benefit will help keep those centers financially healthy and perhaps make it more enticing for other organizations to consider starting to standalone centers themselves. To anyone who's accepted those services, there's little doubt that the people that actually perform those services are angels of mercy. We thank them for their care, thank them for the bringer of the bill, offer our support to the bill, and happy to stand for any questions.
Questions for Tom? Seeing none, thank you very much. Mr. Lehman, welcome to the committee. We haven't seen you yet this year.
Thank you, Mr. Chairman, members of the committee. My name is Mike Lehman, representing the Catholic Diocese of Cheyenne, here to support the bill. I debated whether to share this, but a few years back, a bill on palliative care was brought, and I was getting a lot of input. The problem was I knew almost nothing about palliative care at the time, and so reached out to some of my, sorry about that, colleagues around the country. And one of the things that I'm very concerned about, given the libertarian sort of philosophy in our state, is physician-assisted suicide legislation. We've seen that happen in other places. One of the insights that some of my colleagues around the country have recognized is that typically people don't volunteer or sign up for those sorts of things. It's when they see people who are at end of life care not having any sort of resources, not having care, that suddenly that kind of legislation begins to gain popularity. And that really sort of changed my understanding of palliative care, but also hospice as well, that we want to fortify the good work that people are doing already around the state in this critical area of need. So I thought I would just share that briefly. Stand for any questions.
Questions? Senator Dockstader.
Deacon Lehman, I was trying to make the connection, assisted suicide in this. I didn't make the connection you were trying to make there.
Mr. Chairman.
Go ahead, Mike.
My apologies, Senator Dockstader, that from testimony from some of my colleagues around the country, what they believe is that by providing healthcare, hospice and palliative care, when people recognize that, when you reach that stage of your life, there is a system in place, that you're not just sort of left to bear without any pain management, without other care. There is this increased sort of need that people experience to look for other options, because that's sort of the worst fear scenario in people's minds, that what happens if you're critically at the end of your life and there is no care. Does that make sense? Or?
And I would just add on to that is the second highest group of suicide nationally is the elderly end of life care. That's where it's the young folks, and then that's the second highest. Senator Hutchings, go ahead.
Thank you, Mr. Chair. Thank you, Deacon. I too was kind of wondering where you were going, but I think I have it. You're saying that without this care, people will seek other means and possibly suicide. That's the gist of what you're saying.
Mr. Chairman.
Go ahead, Mike.
Senator Hutchings, thank you for speaking clearly when I'm apparently not capable of doing so this morning, but that's.
You're very capable, sir. You're doing a very good job. Okay, no further questions. Thank you for coming. Welcome. Feel free to come anytime you want.
Thank you.
Okay. No further comments in the room. Do we have anybody online, Ms. Shippen?
We do, Mr. Chairman. We have a Mark Pepper online. Oh, actually, we have two people online. Shall I admit them both?
Okay, I would remind you both online, we need to keep this moving. We have one more bill sitting in front of us. If you go ahead and join us online.
I admitted a Mr. Mark Pepper.
Mark, we're waiting. There you are, Mark. Can you hear us?
Good morning. Thank you, Senator.
Go ahead.
On and for the bill. I've fortunately experienced hospice comfort care recently and have a long history of family, friends, and neighbors and who've utilized the services both in a center as well as in home care. And I guess I'm speaking for myself this morning. I'm just in support of anything we can do to support these centers and give the end of life dignity that people should be allowed who can't otherwise afford or have other programs that they can take advantage of. And I would stand for any questions or just would appreciate the committee's support.
Thank you very much, Mr. Pepper. Questions for Mark? Seeing none. Thank you very much, Mark, for joining us today.
Thank you.
I missed the name of our second presenter there, and it's covered up on the screen. So if you
Alyssa
can
Nathan.
introduce yourself, ma'am, and go ahead and speak.
Hi. Oh, sorry. Thank you for hearing me out today, Chairman and Senators. My name is Elisa Nathan, and I live in Casper, Wyoming. I would venture to say that, like most Wyoming families, we were poorly prepared for the end-of-life plan for my mother-in-law. We learned as we went along. And during our 5-year journey that went from hospital stays to assisted living, rehab centers, et cetera, we came to love and appreciate the palliative care that Joan received in the hospice home in Casper, Wyoming. And I can say that after our 5-year journey that we began to be great observers of the care for end of life. And we soon learned that not all care is created equally. I can say with even greater conviction that when it comes to hospice versus nursing home and the Medicare funding, that it should be equal, 100% equal. From my perspective, it allows people who are already probably receiving room and board assistance to receive it in a different facility. And that was what was true for our journey. My mother-in-law was already receiving the state assistance But it was when she was transferred there, I feel like the care was absolutely the cream of the crop, the crown jewel of the care that we could have hoped to receive for her. Since I'm limited on speaking today, I just wish to say that I believe that as many people as possible should be allowed to pass on in the end of their life journey with as much care and dignity, and that the assistance provided by the state for room and board, probably which is already in place for many of these Medicaid patients, should be also equally funded in the hospice arena versus the nursing home because of the care, which is just far, far superior. Thank you.
Thank you. Any questions for Alicia? Elisa, I'm sorry. Seeing none, thank you very much for joining us today. Anybody else with shipping online? That's it. We'll close this to public testimony, committee discussion, thoughts, ideas on the bill. See none, anybody want to move the bill? Moved by Senator Barlow, second by Senator Dockstader. Okay, no discussion. Let's go ahead and take a roll call.
Mr. Chairman, this is a roll call vote on Senate File 69, hospice care reimbursements. Senator Barlow, Senator Bouchard, Senator Dockstader, Senator Hutchings, Chairman Baldwin. We have 4 aye and 1 no, Mr. Chairman.
Senate File 115, you may have remembered being House Bill 5. This is called Behavioral Health Redesign Amendments. This was a committee bill that we worked on this summer. Pretty straightforward. And actually, for an explanation, I'm going to bring a Department of Health up here, if I could, Mr. Fuchs, who's more than familiar with this, and give us a good, concise explanation of what the bill is and what it does. Go ahead, sir.
Thank you, Mr. Chairman. Again, members of the committee, my name is Franz Fuchs. I'm Policy Analyst, Department of Health.
Mr. Chairman, our mics aren't working, and I want that, it's not you, Mr. Fuchs. Something's not working in the system.
Yeah, it's got to go out online. We could let him use one of the mics up here if we need to. Are these mics working?
No, these aren't working either.
Mr. Chairman, there is some transcript happening on the online, so it may be catching up the audio somehow.
Okay.
There's something.
Okay, go ahead and proceed. Talk a little loud so we make
Yes,
sure.
Mr. Chairman. So just to step back a little bit, there's kind of 3 worlds I want to talk about with this bill. There's the world that has been in the past for the community mental health system that has been probably in effect for the past 10 years. There's the world that's going to go into effect if this bill does not pass, which is behavioral health redesign as previously conceived. And then there's the world that is modified by this bill. And that will hopefully explain kind of the differences of what exactly this bill is doing in the 2 sections. So previously, let's talk about the first world. In current law and in the practice for the past 10 years, we have been paying these community mental health centers on a block grant basis, meaning we've been providing them, writing them a check every month, and they, in exchange, they provide a certain number of hours of service. They report hours of service to us for a quota. And so there's no like tying those specific hours to specific people and the billing that behavioral health redesign contemplates. And so there is no real third-party liability function that happens right now. We can't really, we tell them, you know, they need to bill private insurance first, you need to bill Medicaid first, but we don't verify that at the claim level and bill the insurance company for third-party liability recoveries that we identify, for example. So additionally, anybody, as far as eligibility goes, pretty much anybody is eligible for these services. You can walk into a community mental health center and they will put you on a sliding fee schedule based on your ability to pay. That's the first world. That's the world we live in today. The world we're going to without this bill is the behavioral health redesign, where we're limiting eligibility. We're shrinking it down. And the largest category of folks under behavioral health redesign is can be called indigent general access clients, which you see in Romanet 19 in the bill. And as originally contemplated, that group did not include, it specifically excluded people that were covered by public or private insurance that had behavioral health benefits. So when we're moving from the current world to the next world in behavioral health redesign, a lot of folks may potentially lose access to behavioral health services that are paid by the state. That includes, so for example, just a concrete example, someone on Medicaid, as we talked about in the past bill, Medicaid does not cover room and board, right? So for example, certain services, not all services, Medicaid has a pretty robust behavioral health benefit, but certain services like substance use residential treatment, if you're in this category, if you're indigent, right, below 200%, and you don't fall into a higher behavioral health redesign priority population category, we will not be able to pay for that, for example, that particular benefit. In addition, people with private insurance, maybe they have a very high deductible. If you have an employer plan, for example, and you have a $5,000 out of pocket, those folks would be excluded as well. And we would essentially deny those claims and tell the provider to bill insurance. And of course, per that contract, they would have to bill the person to get that max out of pocket. So that's the world that BHR will implement absent any action by the part of the legislature. What this bill does in the first section, as far as the eligibility goes, is it modifies it and it strikes out the insurance provision. So that will essentially allow people who are indigent that have public or private insurance to receive certain behavioral health service center benefits, just like they do today. So when we're talking about expanding or contracting eligibility, we're moving from sort of expanded eligibility in today to a potentially very contracted eligibility without this bill to sort of somewhere in the middle with this bill passing. That was kind of a very long-winded, against your advice of being concise, Mr. Chairman, but I hope that kind of explains how exactly this is changing and not changing things. And the same thing goes for the third-party liability perspective. We're going from a world where we do not do that activity at all to a world where, without this bill, we will, if we have any indication that somebody has private insurance, we will deny that claim and tell the provider to bill that insurance. If this bill passes, we will instead track the amount of money that may be potentially recovered from that action, but not actually deny the claim. We'll continue paying the claim as we kind of do today in this block grant world. So two aspects of this bill. There's an eligibility aspect in the section 1 and a third-party liability component in section 2. And I hope that kind of illustration of the world of today, the world of behavioral health redesign, and the world this bill might modify, hopefully it helps explain kind of where those two aspects of BHR are changing.
It does. Thank you, Mr. Fuchs. And I would add on to that, there is the ability, when you come back to this committee down the road after we activate this in July, that we will review how it's going and review what's going on. So we'll review the actual numbers, what we've done. So questions for Mr. Fuchs committee? Senator Hutchings.
Thank you, Mr. Chair. Franz, page 2 lines, or the section 2, where it says that if the, let me see, lines 15 through, let's just go to 19. Explain that. You're still gonna pay the claim and you say you're gonna track the money even though they may not be eligible? Is that what's going on there?
Mr. Fuchs.
Just wanna make sure.
Mr. Chairman, Senator Hutchings, so let's pretend that somebody is low income and they have private insurance, right? If today the behavioral health center is supposed to serve that person regardless of ability to pay. And if the person doesn't tell them that they have private insurance and the behavioral health center doesn't know, they might assume they're uninsured, and we would pay them through the block grant and they would report those hours to us as part of that quota. So effectively we are paying for those services, even though it's not necessarily a claim, but like a billed claim basis like Medicaid is. It's a block grant system. But that's kind of the world we are today, where we don't really check, we don't have a system to check the third party liability that this person pings in our database as having insurance. And therefore, it's really up to the provider and the person to tell the provider that that person is insured. That's how it works today.
Right. Mr. Chair, so in essence, I can have insurance and come and not tell you I have it, and you're gonna pay it out of the block grant.
Mr. Chairman, Senator Hutchings, that's the case today. But that's changing under behavioral health redesign. We're moving to a system where we can verify now that you would have insurance, and we will deny those claims and say, therefore, and we'll tell the provider, we're denying this claim, but you should bill the insurance for those services.
Gotcha. How do you have the, excuse me, Mr. Chair,
Go ahead.
how do you have the ability to verify it right now where you didn't before?
Go ahead, Mr. Fuchs.
Mr. Chairman, Senator Hutchings, so what BHR is doing is folding a lot of the service payment infrastructure into the Medicaid system. So we have this Medicaid infrastructure that does this for Medicaid clients. So we have contracts with almost all the major insurers in the state where we have data matching systems where we can say, okay, is this person covered by Blue Cross? And we have that database. And then Medicaid will deny those claims and tell the provider to bill insurance. These block grants have been administered for decades in the Behavioral Health Division. So it's separate from Medicaid, mostly general fund, and done on sort of the block grant basis, so paid by checks, basically, not through claims.
Right.
And so Behavioral Health Redesign moves a lot of that service payment infrastructure into the Medicaid system. It's not Medicaid paying for it, it's still general funds, but we're using the infrastructure that we've already built to process those claims and do the third-party liability and everything else to verify that. Did that answer your question, Senator?
Yes, thank you.
Further questions for Mr. Fuchs? Senator Barlow.
Thank you, Mr. Chairman. So in the structure of this bill, and I'm just going to go to that indigent general access client definition, I guess I'm struck by, we're actually not changing anything until July 1st, 2026. Is that how I should interpret both the stricken language context of the added language? So nothing is actually going to change until July 2026. Is that accurate, Mr. Chairman?
Go ahead, Mr. Fuchs.
Mr. Chairman, Senator Baldwin, I'm sorry, Senator Barlow, no. The stricken language goes into effect 2024, and then what's added is a sunset. So that effectively reverts it back to the stricken language, right? It says, so after July 2026, a person who has private or public health insurance shall not qualify as an indigent general access client. So this basically this bill opens a 2-year window by which those people with insurance would be eligible under this category.
Senator Bouchard.
Thank you, Mr. Chairman. I want to come back to this sunset because we're seeing that on multiple bills. So can you give us a 30,000-foot view of what's happening, why we keep seeing this same sunset?
Mr. Fuchs.
Mr. Chairman, Senator Bouchard, the sunset's not something that we asked for in this original bill. I can't speak to the motivation. I think it was added by this committee in the interim. My understanding is that the committee wants to understand how BHR is progressing, and there's some automatic fail-safes potentially built in 2 years. That's my interpretation of what the committee was intending to do with the sunset, but I don't know for sure the motivation since we didn't ask for it.
I believe that is what happened in the interim committee. We decided to bring sunset for a look back to see how it was going. Senator Barlow.
So thank you, Mr. Chairman. I think to this is the point on what I think the previous answer confirmed is actually in this particular client base, nothing will change until July. If we pass this bill, nothing will change until 2026 for this particular client base, even with the stricken language, because we're making it a non-qualifier now. They can have it or not have it. So anyways, but the 2026 language, yeah, that's not, the Department of Health would probably rather not have that. They'd probably rather get moving with it, but that's us doing that, it sounds like. Thank you, Mr. Chairman.
Further questions? Thank you very much, Mr. Fuchs. Others in the room who wish to testify? Welcome, Ms. Somerville.
Thank you, Mr. Chairman, members of the committee. Andy Somerville, Executive Director for the Wyoming Association of Mental Health and Substance Abuse Centers, and I will try to be very brief. We've had a lot of discussion on this bill over the interim. Complement to what the Department of Health testified to. This really is a bill about making sure that we can provide appropriate and necessary services to those that are coming to the community mental health centers. This is an incredibly high-risk population, especially when you're dealing with substance use disorders. We know that if we don't get them the proper services, they are much more likely to end up in the criminal justice system, being held in jails, decompensate, end up in the state hospital. And I want to highlight one particular group that might be affected if this bill is not passed, and that is the pregnant and parenting women. So the state currently contracts with community mental health centers for a number of beds where women who are pregnant or have just recently had a child, up to I think 3 or 4 years old, they can bring them into a substance use residential program. Especially on the pregnant side of that, most of those women have Medicaid. They do not have any means. So if they are in a situation where they are pregnant and facing a substance use problem, if this bill is not passed, the community mental health centers will not be able to provide that substance use residential treatment. And this is a group of residents in Wyoming that are not going to have the ability to seek a private residential facility or potentially be able to access that service anywhere else. In our estimation, what this bill is really giving us with the sunset date the opportunity to do what we've been talking about for the last few years with behavioral health redesign, which is to implement it July 1 of 2024, and then come back to the legislature with some updates and reports. And so that sunset date does allow for that to happen. I think the intent is to continue to provide a report through this interim, and then I believe this bill talks about a September 2025 report as well. We are certainly comfortable with that as the community mental health centers, and in fact appreciate the ability to report back. This is a massive system change. To move a community mental health system to a completely different eligibility system and payment system is no small feat. And the community mental health centers, working alongside the Department of Health, have been putting in countless hours to try to make this all work. I want to talk just a little bit about the billing procedures. Currently today, and for quite some time, community mental health center will screen a client as they come in the door for insurance to the best of our ability. They will screen them for Medicaid. We already do those pieces. What behavioral health redesign will allow us to do is to do that better, to allow the state to help us with that. So we will continue even after July 1 of 2024 to screen clients at the door, try to make sure that we're using any other payer sources besides the state general fund that we can, and move forward in that vein. And the last note that I would make for this committee is that the community mental health center budget is a capped system. I understand that over the last week or so, there's been some misinformation and misunderstandings about this bill. There is no fiscal impact of passing this change. The community mental health centers still have to provide services within the capitated budget, so there's no additional cost to the state. Mr. Chairman, with that, I would stand for any questions.
Questions from Ms. Somerville? Senator Hutchins.
Mr. Chair, Mrs. Somerville, did you say that the community mental health system is a cash system?
Ms. Somerville, go ahead.
Mr. Chairman, Senator Hutchins, my apologies, a capitated system.
Capitated.
Set amount of money in the budget for state general funds.
Thank you. Continue, Mr.
Go
Chair.
ahead, follow up.
Question on page 2, section, what is this? A, the act on page 3, or line 3. When it says indigent people that were coming in before or now, we are just taking them in and we're just paying for them. And then you have the system that you want to deal with up until 2026, where you're using your insurance to pay, public or private, and then the state puts in their share. Why would you not want it any other way? Serve people and just start handing out money without tracking or keeping, without tracking it. Why would you want it any other way?
Ms. Somerville.
Mr. Chairman, Senator Hutchings, so there's a couple of things. There certainly is value in better assessing the services that we're providing across the state, to whom, for how long, what are the needs across the state in Wyoming. We can do a better job with that, and I think behavioral health redesign will certainly help get us on the right path to being able to take a better look at that data. And second, I just want to clarify, in terms of if this bill passes, what this does is allow the community mental health centers for this population to continue to do what we have been doing for 2 years in terms of providing those services. Now, we will get paid for those services in a different manner. It won't be on the block grant model. It'll be on essentially a fee-for-service model where we're billing differently and collecting different data from the state. Does that answer the question?
Thank you. It does clarify, Mr. Chair, if you don't mind.
No, go ahead.
You won't be using the block grant, which sounds to me kind of wild. But I come in, I need a service, I provide you, or my insurance company provides you the money for what you gave me, that does sound better. So thank you.
Okay, further questions, committee? Thank you very much, Ms. Somerville. Others in the room? Online? None. We'll close this to public comment. Committee, suggestions, comments, amendments, criticisms? Move the bill. Second. No discussion. Let's take a vote on the bill, please.
This is a roll call bill on Senate File 115, Behavioral Health Redesign Amendments 2. Senator Barlow?
Aye.
Senator Bouchard? Senator Dockstader?
Aye.
Senator Hutchings?
Aye.
Chairman Baldwin?
Aye.
We have 4 aye and 1 no, Mr. Chairman.
That bill passes committee. I will take care of it on the floor. Unless somebody else has a burning desire. And I know you don't, so I'll take care of it. Okay, that ends committee. Committee, Wednesday, take note, we're beginning at 7:30 rather than 8 o'clock. We have 2 bills. It's our final day to consider Senate bills. We got 2 bills before us on Wednesday, so 7:30. Eat your breakfast early. Thank you very much, those who came.